Well, welcome everyone to our Health and Wellness Thursdays, starting off the new year with a great presentation. I'm Rebecca Crane-Okada, and I'll be moderating today. I'm the program manager here for the Margie Petersen Breast Center and an oncology clinical nurse specialist. And the topic today is What's Next? Breast Cancer Thrivorship with Tara Ower. And Tara is a nurse practitioner trained in family health and runs our breast health clinic and our after breast cancer clinic, or the ABC clinic. Tara is educated at Southern Methodist University and the Western University of Health in, what's that town?
Pomona.
Where? Pomona?
Pomona.
Yeah, it's a long ways away. And she completed her family nurse practitioner and her master's degree training there. Tara is recently married, so some of you may have known her as Tara Kays. And she is now Tara Jean Ower. And Tara is also certified as a clinical breast exam trainer with a national program. Tara's been with us, I think, about 3 years now. Four, gosh.
Time's flying.
And Tara's been a nurse. She was inspired to be a nurse by her mother, who was a nurse. And Tara has worked here in oncology nursing, med surg, and then completed her master's degree and her nurse practitioner. And we're very fortunate to have her here. When she's not working, I just want to read this little bio about her, which I had not read before.
You hadn't? I thought you were doing this off the top of your head.
Tara enjoys traveling and exploring new countries and taking photographs. And she's been to Japan, Thailand, Mexico, South Africa, many other places. She can tell you about her honeymoon at some point, which was in European countries. She enjoys baking, live music, and taking photos. Coming from a family of 10 siblings, she knows what it means to be a caregiver. She's natural at it, and we're all blessed to have her with us. So Tara, I turn this over to you now.
Thank you, Becky.
Yeah.
Okay, go on. So this is this is meant to be casual. It's kind of a presentation, but also feel free to ask questions about anything. I just kind of made little slides on different topics that we can kind of discuss. As Becky said, I run the breast health clinic, Margie Petersen Breast Center. That includes kind of our quick access for your breast. So if someone ever feels a lump, they can actually call and get in same day to see us, get their diagnostic testing. You know, if it's benign, which 90% of the time it is, they continue to see me. And if it is malignant, then, you go see Dr. Grumley, Dr. Fancher in the MDC clinic, but it's an easy transition. The other part of this, and we'll kind of talk about it later, is I run our high risk clinic. So anyone with a family history, and we'll kind of touch base on that for anyone with children or whatnot and what that means for them. And then the last piece of the puzzle is the after breast cancer clinic. So what do you do when, all that acute active breast cancer treatment is over? So, a lot of people have different names for it, right? We hear survivorship, we hear thrivorship. I kind of just put both on here because it's really a personal preference how you want to view it. It's your life, it's what you've gone through. So survivorship or thrivorship starts when your active breast cancer treatment ends. So when you're no longer going through surgery, no longer going through chemotherapy, or no longer going through radiation therapy as well. Some people get a little bit confused because with breast cancer, right? There's people that do have metastatic breast cancer that, are living with it. Survivorship, thrivorship does mean living with metastatic breast cancer. The other thing that can get a little bit confusing is some people are on, can you see my face now? Some people are living, taking tamoxifen or Vista or any kind of anti-estrogen medication. If you're taking that, you're still considered in survivorship, thrivorship. Basically, it is looking at your long-term wellness, your overall physical, financial, social, and emotional health. So we want to look back at the whole person again. What's been, what's great is there are 4 million survivors in the US, and deaths from breast cancers have declined by 42% in the last 30 years, and that's all because of extensive research, extensive new trials, new screening techniques, new surgery techniques, as you guys know, new radiation techniques, all of that. You can keep going, Becky. So this is just kind of a note about, thrivorship, survivorship at FNP-C, what we do here, just to make it a little bit clearer. So after you see your surgeon and you have breast cancer surgery or whatnot, radiation, chemo, you will continue to see your surgeon every 6 months for the first 2 years. Whether it be just to come in for a clinical breast exam or get your mammogram, every 2 years, you will be seeing every 6 months for 2 years, you'll be seeing your surgeon. After that, you do transition into the after breast cancer clinic. That's with me. And you continue to do your annual mammograms and clinical exams with myself. What's really nice about it is we're still in the same clinic as Dr. Grumley and Dr. Fancher, right? So if you ever need them, we can go grab them. But it just makes it a little bit easier so you can just come in annually, get your mammogram. I see you right after. I give you your results. We do your clinical breast exam and you're good for the year. If anyone's ever, did go under a mastectomy, you don't need any mammograms anymore, but you still need annual clinical breast exams. And then MRIs is a big question we get. Why are we not doing, annual MRIs on people with breast cancer? We only do annual MRIs on people with breast cancer that if that's how we found your breast cancer through MRI, then we will continue to do MRIs. But if we didn't, then we'll continue to do mammograms. And then what we've started implementing is actually something called a survivorship visit. That is actually, and we'll kind of go through all the different elements today, but it's a visit with myself during the first year out of treatment, just to kind of sit down and do almost like a wellness check. How are you doing mentally? How are you doing physically? How are you doing financially, socially, emotionally, right? Because you're going through all these moments of doing treatment, right? And for a long time, you're just kind of doing what you're told, but no one's really checking in to be like, well, where's your head at? Are you really stressed that you can't pay the rent this month? That kind of stuff. So we've been implementing that so that we can have a nice wellness check-in and do a survivorship visit. And then obviously you guys know because you're here, but Becky offers so many wonderful wellness activities like equestrian and painting and different things. You can keep going, Becky. Okay, so I don't know if you guys have ever heard of these, but there's something called a survivorship care plan. And these would be provided to you in your survivorship visit during that first year. Basically, it used to be a document that was required, but it's no longer required in the state of California. We actually just like it because it's a detailed document that you get that's in my chart or that you can have in your hand that says exactly what treatment you went through, exactly what surgery you had, exactly what cancer did you have, who all your providers were, and what exactly are your recommendations for screening. So it gives a very good synopsis. That's not the word. Something. Okay.
Synopsis.
Synopsis. In my mind, I was thinking like the brain synapse of like your whole journey and what do you need to do next. It's really good because it helps that communication continue through your lifetime. It's something you can bring if you get a new PCP. It's something you can bring if you have a new OBGYN. You might go 5-10 years down the line and you get a new provider. It's really nice for them to have to say, oh, this is what I went through. And then they know exactly who you went through it with. Go ahead, Becky. So this is one of, this is the one everyone kind of thinks about, of course, after breast cancer and after surgery and and chemo and radiation is your physical self, right? A lot of this is what we work on in that survivorship visit and in the after breast cancer clinic. You're always going to have side effects from surgery and chemo and radiation, but you're also, some people have long-term side effects that go way past that acute phase, such as cording or lymphedema, hopefully not as much lymphedema with Dr. Fancher and Dr. Gremley, but there's menopause symptoms, joint pain for our younger patients, infertility, just the infertility for the younger patients, and then low libido for everyone, vaginal dryness, heart problems, fatigue, osteoporosis, memory loss, neuropathy, hair loss, and bone pain. So there's a lot of different things that people don't understand, like can be these long-term side effects that still need to be managed, right? So that's something that we can work through. Another one is scar tissue. When people go through surgery, the first thing in your kind of mind is, oh, I want it to look good. I'm worried about what the scar is going to appear like. But people never think about actually scar tissue is painful. And if you have, if you don't heal correctly, or if you do surgery a certain way, you can have some pretty bad scar pain. So a lot of the time we try to get our patients into physical therapy pretty fast if they're starting to have any kind of cording or scar pain. We have great physical therapists across the street. And we have two that are trained in lymphedema and also cording and scar tissue. And so they can work with you if you're having any kind of pain. And then another one is post-mastectomy pain syndrome. Same thing. Our physical therapist can work with that. That's almost when you have nerve pain that lingers after a mastectomy. Financial, this is another big one. The cost of treatments can always be such a strain, right? Even with health insurance is not always the best. It is always not helpful. And also it's not going to help you pay your rent or get you to your appointments, or, if you have to travel or anything like that. So we always want to touch base that everyone's doing okay. I know sometimes it is hard to ask for help, but we do have a lot of resources available through the American Cancer Society, through ourselves. At FNP-C, we always offer our patients a lovely fund that we have is called the Breast Cancer Patient Support Fund. And that is a $599 once a year fund that people can use to anything that's not medical expenses. So you can use it for groceries, you can use it for rent, you can use it for whatever. It just can't be to pay your medical fund. But that's something that we like to at least make sure everyone knows about, because if you don't know it's there, you might be struggling and not really know to ask. We have great social workers that work with us, and they also have a lot of resources to help as well. Go ahead, Becky. Social, this is very important to you. We want to check in and make sure everyone has a good supportive community around you. Not only just your immediate family and friends, but support groups, churches, walking groups, everything like that. Cancer can get very isolating. People kind of think they don't understand what they're going through. They don't want to hear about my worries. They don't want to hear about me being sick again. So it's always good to make sure that we're vocal if we need mental health help or anything like that. Also talking about relationships with your partner, getting intimate, making sure that they know that they might need support too, just helping you out. Go ahead, Becky. And then emotional. The American Cancer Society says that 1 in 4 with breast cancer actually have depression. Which, makes sense. It's a very traumatic and horrible experience to go through. But, everyone's reaction to the diagnosis is unique. I've seen this a lot because I run that breast health clinic, whereas as I run the breast health clinic, I am one of the first people to tell someone they have breast cancer. So I've told a lot of people they have breast cancer, and it is very interesting to see how everyone reacts very differently. I've never seen one person react the same as everyone else. Everyone is unique, and then their reactions are unique. So, it's very important to check in with yourself, check in with your providers, make sure you're doing okay, and we can get you the help you need. The one that we touch on the most with survivorship is more returning to work, returning to normal life. And I put it in quote because life isn't ever really going to be normal again. You went through a traumatic event. But a lot of people get anxiety in this period for multiple reasons, right? There's, okay, I'm done seeing all my doctors all the time. And while you're seeing all your doctors the time, you know you're doing everything, right? You're doing everything you can. You're going through it. When you stop and they're saying, oh, no, you're done. I'm not going to see you for a year. There's actually a big anxiety to that of, wait, you're not going to see me for a year? I've seen you every, day for years. And so there's a lot of that adjustment period of working through, okay, this is okay that I'm not going to see them for a while. It's okay that we're waiting this long. And then also working with that anxiety regarding reoccurrence, right? Is it going to come back? What can I do to not have it come back? All of that. Go ahead, Becky. And then a lot of questions I get in the ABC clinic is, what about my children, right? If you've had breast cancer, then your children are actually considered high risk because they have a first-degree relative with breast cancer. So just a good no is that your daughters would start screening earlier than the recommended protocol. So the normal recommended protocol is actually age 40 for like everyone else that does not have high risk. So if they don't have a first degree or any kind of family history, then you start your mammograms at age 40. But for anyone that does have a first degree, they would actually start at age 30. If someone has like a genetic mutation, like BRCA or CHEK or anything like that, you wouldn't test your kids until at least after they were 18. And if you want anyone to ever see your kids or anything like that, we do run the high-risk breast cancer clinic where we can get them started early. Go ahead, Vicki. And that's kind of it. Any questions? I think the main takeaway is, like, we're always here for you. Just because, you've gone through everything and are in your survivorship, thrivorship, that doesn't mean we're gone. We're always here if you ever need anything, if you ever need help mentally, financially, physically, if you ever feel a new lump, anything, you can always contact us. We're always here. Any questions?
Thank you, Tara. Let's see if there are any questions from anyone.
Sorry, you couldn't see my mouth.
I have a question for you. How do you coordinate for patients who are seeing their medical oncologist and radiation oncologist? And how do you coordinate with that, with their schedule of follow-up?
Theirs is a little bit different because with us, our surgeons like to see you every 6 months for 2 years, and then we'll continue with your mammogram annually. A lot of hematologist oncologists do still continue to want to see you every 6 months for a good amount of time. So we try to coordinate it at least to make sure, they're all kind of in the same area, that you can come see them at the same time. But we usually continue with your actual imaging, whereas it's still important to meet with your hematologist oncologist or your radiation oncologist, because they're looking at different things, right? We're going to be doing your mammogram and checking your breast, but your hematologist oncologist is going to be more talking about how are you doing on your tamoxifen, and should we adjust this or anything like that, looking at your lab works. So it's still a joint effort with all of us. Eventually, you will just go down to your annuals with me, but I know each hematologist oncologist is different. Some like to see you for 5 years, some see you for 2. So.
Tara, Gail here. How are you?
Hi, Gail.
Anyway, I want to thank you for doing this program. It's amazing, because one of the concerns I have is it'll be coming up in a year and I have to have my mammogram with Dr. Grumley. So you and Becky doing this program and walking through and acknowledging the anxiety and things that you do, and just talking through it is very helpful.
Yeah.
And also just to say the whole team there at the Margie Petersen Breast Cancer for me has been amazing. They've been with me all the way. So thank you. And thank you for continuing to do these programs to help us through it. It's not just the surgery's done, the radiation's done. They're amazing to help and just address concerns that you may have. So thank you.
Of course. Thank
My
you.
last thing is, and one of the things that we talked about, because I am on Arimidex.
Yeah.
And it's about, and it's such a minor thing. I hate to complain about it, but I am experiencing hair loss from having the radiation. And I talked to Dr. Petty about this.
Mm-hmm.
I'm on biotin.
Uh-huh.
And which is I've just started it, which is helping. And then my question is there any other things that you would recommend to do to take for this concern?
For the hair loss. Biotin is actually the main one. It gets hard at this point when you're on the Arimidex, adding in a lot of like vitamins and supplements, because then they can kind of clash together with it, right? And cause more side effects. But how long have you been on the biotin? Because it's going to take a while.
Yeah, well, I've only started actually a couple of weeks, so I'm being
Okay.
patient. But I do actually see, I don't know if it's my imagination, but I want it to look different,
Yeah.
but it looks like it seems to be working. And then the other question along that line is the radiation. So it's been about 6 months since I've had that. Because the body was in shock, does it come to a point where the hair loss or thinning stops
Yes.
and levels out? Okay.
Yes. Yeah. That will all stop. It's just that that's that acute period, like we were kind of talking about. But it does get to a point where that doesn't happen anymore.
And again, this is such a minor thing based on what everybody else goes through, but it is a concern.
Yeah,
and
but it's your thing. It's your journey. Remember, everyone's very unique. And it's
And
still
my last thing, Tara, is your extensive traveling that Betty had mentioned. You have to add Scotland to your list.
I'm actually supposed to go to Scotland with my mom in May. Ireland and Scotland. She's a huge Bruce Springsteen fan, and she has decided to follow him around Europe. And I'm joining for Ireland and Scotland. So I'm so excited.
Enjoy it. Thank you.
Thank
Thank you
you.
both very much for all you're doing. Thank you.
Thank you. Yes. Any other questions? But yeah, I would just give the biotin some time. It can take about 3 to 6 months to like actually have something work. But there's nothing else. That's like the main protocol for it. It gets hard, like as long as you make sure you're taking iron, a multivitamin, all like the normal stuff, vitamin D to help kind of replenish your system. But over time, it will start to grow back as your body kind of keeps regenerating and healing.
I have a question.
Sure.
You might have said this, but I missed it. So I have a double mastectomy. So does it mean like it will just be breast exam in the future since there's no mammogram and you said no MRI.
No, so they can't, well, it depends, Alex. So with a double mastectomy, they do leave some tissues. So if you ever feel something, we can do a mammogram. There's just no point in doing a screening mammogram. So annually, you should be doing clinical breast exams though, so that we can at least feel for you. Do you have reconstruction, Alex?
Yes.
I remember. Then every couple of years, you should be getting an MRI, not for cancer, but actually to watch your implants.
Oh, wait, I have a flap. I have a deep flap.
Oh, then never mind.
Okay. So basically just the clinical breast examination.
Clinical breast examination. But if you ever feel anything, especially if you have a flap, then we can actually do a mammogram on you. And then like, if you ever feel anything, we can always do an ultrasound too, but screening wise, it's just clinical breast exam.
I see. So only if there's something abnormal, then
yeah. So exactly. So everything's still available to you if you actually feel a lump or anything like that. Nothing's taken away. But screening wise, they just don't feel there's, they're not going to see much on it.
Okay.
Mm-hmm. Any other questions?
Well, thank you, Tara. This has been great.
Thank you.
Yeah.
Enjoyed
And
it. It's good.
for attending.
Thank you, Tara.
Anytime.
Thank you, Becky, so much. Thank you.
Of
Thank
course.
you.